Hey guys, Aaron Farmer here with MySugarFreeJourney.com. Did you know that Dr. Oz was sworn in as the head of the Center for Medicare and Medicaid Services back in April? Somehow or another, I missed that. So I went back and watched the speech that he gave when he accepted the position. I thought it was pretty interesting. The big idea that he is basing his entire plan on for what he wants to do with the CMS is the fact that 70% of the healthcare expenditures in this country are driven by chronic disease. That is a massive number, and it's going to be the main focus of his agency moving forward. I want to talk about one particular aspect of his plan. The fact that it's the long-term chronic disease that is bankrupting our country's healthcare budget and robbing our American citizens of years of life and health. Americans aren't just dying faster, they're getting sick sooner and spend most of their time managing these chronic diseases. In fact, the 70% of healthcare expenditures that Dr. Oz talked about is primarily the many medications that each person has to be on to control each of the chronic diseases they have. You come into your doctor, you get your blood pressure, your cholesterol, your A1C checked, and most people walk out of the doctor with a prescription for one or more of each of these issues. Ask any of your friends when the last time was that they went to the doctor and did not get a prescription for something. I guarantee you that it is very rare. But in terms of cost to the bottom line of the healthcare system, none of these drugs can hold a candle to what is just around the corner. Right now, Ozempic is covered under Medicare Part D for type 2 diabetes, but there is a strong push by pharmaceutical companies and the lobbyists that control them to get Ozempic approved for weight loss on Medicare. What happens when a very expensive drug is approved for weight loss in a country with an obesity epidemic? Probably bankruptcy, or we print so many dollars to cover it, we dig a hole we can never get ourselves out of, and maybe we're in that hole already. I don't know. I'm definitely not an economist. So as with most of the things RFK is doing, I'm on board with this. I do think this is something we need to keep an eye on. The government paying for Ozempic for everyone is a problem. We have prioritized cheap carbs, fast food, and junk food to be the cheapest and most widely available food out there. And it's those cheap carbs that are driving obesity and the type 2 diabetes epidemic we're seeing. They also drive up blood pressure. They increase the rates of cardiovascular disease. They cause the lipid dysregulation that gets everybody put on a statin. Fixing the problem would require doctors to spend more time with each patient, educating them about dietary choices instead of writing a script and pushing them out the door to see the next patient. But spending that time talking to your patients costs the doctors money. Writing a prescription makes the doctors money, so I don't see that happening. Anyway, something to keep an eye on. I appreciate you guys for watching. This has been Aaron Farmer with MySugarFreeJourney.com.